Good afternoon and welcome to our daily briefing here in St. Clair County for COVID. I'm joined with Director Herb Simmons and Sam Bierman from the Health Department. Sam, you've got today's numbers.
I do, and as we have done the past couple of days, our numbers are looking pretty good, so we're hoping to keep this roll going. As of today, 92,530 St. Clair County residents have been tested, which is an increase of 598 from yesterday. We are at 7,690 positive test results, which is an increase of 27 from yesterday, and that does include both males and females from under the age of 1 up to their 90s. Our daily county positivity rate today is 4.5%. We are at 84,840 negative test results and announcing no new deaths today, so we are still at 196. For those who have completed the IDPH required 10-day isolation period, we are at 6,957. For state totals, 5,886,418 have been tested, with 301,541 positive test results, which is an increase of 1,453 from yesterday. And for deaths, the state is reporting 8,791, which is an increase of 17 from yesterday. For hospitalization numbers in St. Clair County, currently we have 52 individuals that are admitted due to COVID-related reasons, and 5 of them are on ventilators. And for our regional hospitalization numbers, currently we have 85 individuals who are admitted due to COVID-related reasons, and 6 of them are on ventilators. For our congregate living facilities that are in outbreak status, and we will only announce any facilities that have had a change, the Esquilin Dammert Center at the Shrine has 37 cases and 3 deaths, which is an increase of 2 cases for that facility. And Integrity Healthcare of Belleville has 10 cases and no deaths, and that is an increase of 1 case for that facility. And now I will turn it over to Herb for his update.
Thank you, Sam. We appreciate you every day coming in with those numbers, and I know it's a lot of work even on the weekends. COVID doesn't stop. We'll go into the zip code report. As we have been doing recently, we'll only be mentioning the zip codes that have an increase. 62203 is 222, which is an increase of 1. 62204 goes up to 147, an increase of 1. 62205 goes up 1 to 218. 62206 goes up 1 to 474. 62208 goes up 3 to 460. 62220 goes up 4 to 594. 62221 goes up 1 to 715. 62223 goes up 6 to 466. 62232 goes up 2 to 202. 62239 goes up 1 to 128. 62258 goes up 1 to 199. 62269 goes up 1 to 602. 62285 goes up 1 to 133. And as Sam said, our daily positivity rate is 4.5. The 7-day rolling shows us today at 5.8. The number that I say every day that we work on and try to get down is the regional positivity, and as of October 1st, that is at 7.6 now. So that's the one we got to continue to work on. And we will continue to do that with all your help. Today, Brian, is a question and answer day every Sunday.
Every Sunday.
And we got quite a few questions in today, so why don't you go ahead and give us what you got.
Okay, Sam, we'll start with you. The first question is, are there any mobile testing this week?
Yes, there is. On Tuesday and Wednesday, the 6th and the 7th, we will have testing at McHenry University in front of the HET Center, which is on 400 North Alton Street in Lebanon, and that will be from 8 a.m. to 4 p.m. on both days. And then on Thursday, October 8th, we will have testing from 10 a.m. to 12 p.m. and from 1 p.m. to 3 p.m. at the Moose Lodge number 1221, and that is at 2425 North Illinois Street in Swansea. So we do have 3 options for testing this week.
And we'll have them up on our site.
Yes, they will be up on the EMA page as well for that specific information.
Okay. The next person said, from the previous article printed, IDPH says they have now started to include BJC COVID test results in IDPH totals. On what date did IDPH include the BJC results?
So St. Clair County Health Department, we have always reported the BJC numbers. We've always received them and reported them here on the daily briefings. But it was mid-September when BJC had become an electronic lab reporter to the state of Illinois, which means the results that BJC gets, they get sent to the state, and then they are divided up into the county of the individual that was tested where they live. So mid-September is when they became an electronic lab reporter.
Well, and I think the thing to make sure we want everybody to know, as you just said, we have always received those numbers and they've always been counted here.
Correct.
In St. Clair County.
From the very beginning, yes.
Okay, very good.
The next one says, the past few weeks you shared a graph of the results of contact tracing. Can we provide an updated report?
Sure, I can certainly work on that, and hopefully we can get that done and have that later in the week to bring to the EMA briefing.
Okay. Next person says, if testing is so important, why is it not being offered daily? People work during the week. Weekends may help.
So there are some testing sites that are available 7 days a week. The Jackie Joyner Kersey site, as well as Walgreens in Cahokia, and I believe it is CVS in Swansea and in Belleville. They are all offering testing 7 days a week. So if none of the sites that IDPH or we as a health department are hosting work for your schedule, those are always an option.
The next person says, Monroe County is doing 4 or 5 drive-through flu shot clinics. Has the health department considered this?
So right now, we are not doing any flu clinics as a health department, but we will post any information of locations that are doing any drive-through or flu shot locations.
Okay. Thank you, Sam. Director Simmons, a couple that came in here. First one says, can you please share the communities that are supporting the cause and attempting to reopen the limited indoor dining?
Yes, we put that packet together with the help of the community leaders last week, and it was a turnaround time of about less than 24 hours. And I want to thank all of those mayors who were on the conference call. And I know Chairman Kern sends that same thank you. The communities were New Athens, O'Fallon, East Carondelet, Fayetteville, Shiloh, Brooklyn, Cahokia, Mascoutah, Fairmont City, Fairview Heights, Millstadt, Belleville, Dupo, and Lebanon. And any other that would come in early this week, we will go ahead and send up also. There was some mayors that had called and was still putting it together, so any ones that come in, we'll add them in.
And many have also communicated independently,
Yes.
asking for that assistance. That was part of the conversation we had as well. The next writer says, if local mayors are sworn to uphold the laws of their community and of the state, how can the mayor of Freeburg go on TV and tell businesses to possibly cause harm to the citizens and others that may visit businesses from other towns or those that are traveling? Don't they have over 100 confirmed cases in Freeburg?
I'm not sure what's their zip code is.
They're at 114 in that zip code.
Yeah, so there are 114 confirmed cases that they've had down there. But I think that would be a question that, for that person asking that, to contact the mayor or the city leaders in Freeburg and ask them that. I'm not going to speak for why. They do take an oath to protect the citizens, and if he feels that something's different down there, he has the right to do that. But I would ask that question directly to the mayor.
Okay. The next person says, are there other regions in the state experiencing the same restrictions as Region 4? What positivity figure do other regions have to maintain to avoid restrictions?
Well, Region 7 was just taken out of the mitigation, I believe, but then just recently, late last week, Region 1 is under mitigation, if I'm correct.
Correct, yeah. Region 1 just went under earlier this week.
So it's just not here in St. Clair County, it's different regions throughout the state that's having the same problems.
The next person writes, I follow the updates daily. There is a lot of talk about testing and some the lack of testing. Has there been any thought to having a county-operated test site?
Yes, just recently, last week, Chairman Kern and the EMA staff and the health department discussed that to where it would be possibly set up to where we could even offer some evening hours because people work during the daytime, and then we are definitely looking at that, looking at a couple of different locations and trying to make it where people can get off work and still do it, and then on the weekends.
Okay. The next one said there was a post on social media from the Dupo officer saying they won't enforce the mask or social distancing. How can Dupo allow this to take place? It's easy to see numbers are increasing in that zip code.
Again, I would refer the question writer to that community. We're not going to speak for them. I didn't see the post on there that you're talking about, but if you say you saw it on there, that's a question that I would ask to the officials in Dupo and ask them if they are trying to help mitigate the spread of this virus, and then you get your answer that way.
Okay. Sam, a couple more that came in for the health department. The first one says, why are tents being allowed with all sides down? I understand if they have to open two sides, it's okay, but a tent at Smoking K's in Millstadt has all four sides down. How would that be considered outdoor dining?
So tents are required to have two sides open to comply with the dining guidelines set forth by IDPH. But if anybody that is watching the EMA briefings has any questions or concerns about an establishment that has a tent up that you don't think things are being done right, please feel free to call the health department, and we can certainly speak with you about it and go out and take a look if necessary. The number to the health department is 233-7703.
Okay. The next person says, when will you start providing the numbers of people who currently have COVID-19 in the county? Other counties do this, so the numbers are available.
So we release that number just in a little different way than the other counties do. We release the number for those who have completed the IDPH required 10-day isolation period. And today that was 6,957. So we do give that number daily with every briefing that we do.
Okay. The next one says, why is St. Clair County on the watch list?
That is the question of the hour. So there are 8 different metrics that are used and can be used to determine who is on the warning list status. A county with 2 or more of those metrics become warning status. And this week, the announcement that St. Clair County is back into warning status is for our cases per 100,000 and an increase of our deaths compared to previous week. So those are the 2 metrics that we hit for St. Clair County that then jumps us back up to warning status.
So the one thing everybody had been watching, the positivity rate, well, not something that put us in warning this time.
Exactly.
But there are other metrics being
Yes.
watched as well.
Yes.
Okay, the next person says, does IDPH include results from Arup, Quest, and LabCorp in their totals if a patient is from our community, region, or county? I believe these references labs are in other states.
So I'm not familiar with Arup, but LabCorp and Quest are 2 labs that we do receive results from and are an electronic lab reporter. And majority of the labs that are around here and that are doing COVID testing are electronic lab reporters.
Okay. Director Simmons, a couple more here for you. First one says, the other counties are not following the rules is definitely a problem. However, there is enforcement in our own county now that's also not happening because 1818 Chop House has opened for indoor dining, along with Reif Schneider's, the Depot, and Farmers Inn in Millstadt. The police are not enforcing anything. What can be done about it? If we're going to allow them to open, then we should allow everyone to open. This person recommends revoking the liquor license to put a stop to it.
Well, I wish it was that simple to do, but again, keep in mind, communities are responsible for within their corporate limits. When you name some of those businesses, where they're located at that's where that question should be referred to. I can tell you here at the Emergency Operations Centers, when we receive any of those type of complaints or informational messages like that, we pass them on to the local leaders, whether it be the mayor, the police chiefs, or city managers, whoever it may be, and explain to them that we have received that. We also notify the health department, whether it be St. Clair County Health Department or the Eastside Health District. and as far as revoking liquor license, again, if it's a community, that falls back onto the local mayor and the local liquor commissioner. That's nothing that we do here. We don't do any of the enforcement. So I would recommend that to the author of that question, if you have those concerns, which they're valid concerns, and we get calls every day about the same thing you're saying right there, and we do our best to pass them on and make sure those communities are aware of it.
Okay, the next person writes, the governor's mandates are not laws. Other states have filed lawsuits questioning governor's authorities during the pandemic. Why does St. Clair County not pursue this course of action?
Well, again, I can't speak for St. Clair County as a whole, Chairman Kern, the county board, but filing lawsuits, anybody can file lawsuits. It's a matter of whether you have the merits to be a winner of that lawsuit. And right now, it's not about that. It's about trying to get people to comply. It's about public safety, as we've said from day one. Nobody wants to go out there and take anybody's license away from them. Any mayor that you talk to, and we've talked to them all the time, we just want people to help us get through this pandemic, and we do that by working together, as Team St. Clair has been doing now for 205 days, I think it is. And we would definitely need all the help we can get to do that. So, when you start talking about, and again, lawsuits takes time. So I guarantee you, if people would spend their energy in wearing their mask, washing their hands, watching their social distancing, is a lot quicker to get this thing behind us than being in a court of law.
Okay. The next one, something we've talked about quite a bit on here, but the person says, this is really something that's more of a statement that several of us who own restaurants would like EMA to discuss. Although multiple restaurants are open for dine-in service in our county and abroad, please let people know what the county is doing to remedy these type of situations. Because of that, please let people know not to get upset with restaurants that are following the rules. We all want indoor dining to open, but by not following the rules, people need to understand the consequences of what happens to restaurants and bars that don't follow the rules. Something needs to be stated about what could happen. Obviously, people are not caring about positivity numbers, and customers of restaurants and bars need to know things like tickets have been issued, liquor licenses have been pulled, things of that manner. We talked about insurance companies saying they wouldn't cover if a business chose to open outside of that.
Well, and we talk about that all the time. In fact, there's not too many days to go by on these briefings that we don't mention that, and I just said it, when we get notification of a business that isn't following the guidelines, we try to get that addressed. Sometimes it's a phone call that gets made to that business, and just kind of a friendly reminder that we received information on it, or like I said, we forward it on to those local communities. As far as license being taken away, again, nobody wants that. It does nobody any good to have businesses shut down. And frankly, I get upset when I hear people thinking that whether it be the state or whether it be the county or the municipality, they're not sitting around saying, well, today let's go shut down this. That is tax dollars that are being taken away from those communities, from the county, from the state. I don't know why it's hard for people to understand. This is about public safety. 196 people in St. Clair County has lost their life to this virus. I mean, how many more people is it going to have to take before those who are sitting back behind their keyboard complaining that a business isn't doing what they're supposed to be doing?
Well, and these business leaders, just as you mentioned, we had a group of business leaders come to the county board meeting last week and spoke very professionally and very eloquently on their concerns and what they want to do to get their industry back up and going, but they want to go about doing it the right way because they don't want to risk things like license suspensions, maybe losing their gambling machines in their building, or jeopardizing their business even worse through liabilities that maybe their insurance company has told them they weren't going to provide. So we do have business owners that are stepping up and saying, we want to do this, but we want to do it the right way. And we commend all those business owners, and we want to do that too. That's why efforts are being done, like all the mayors signing on with the chairman. They want to make sure that they're not encouraging businesses to violate the executive orders that could put them in jeopardy of those things.
Well, and we mentioned it yesterday, we heard a couple of the mayors say that they checked with their insurance carrier, their municipal insurance carriers, and they've been told, if you violate the IDPH guidelines and the executive orders, you might as well write your own check because the insurance is not going to cover that. If I was a business owner, I would want to make sure that my insurance carrier gave me the okay to do that. It's too late after the horse is already out of the gate. So I would recommend that, I'm not advocating anybody go against anything, but if there are businesses out there doing it, and as you just said, Brian, the business owners that we have talked to, and a lot of them on a daily basis, are doing their best. They did that, and I think that's why our mitigation, the numbers are down, because, Team St. Clair, the business industry, people out there in business have been working hard.
Yeah, I mean, we're waiting for the day we can come on here and say, hey, great news.
Yes.
We've got the appropriate approvals, and we're going to continue to move forward. We're going to reopen, and we're going to do it safely.
Exactly. I mean, and that's what it's got to be about. And I don't know of a business out there that hasn't got their customers' interest at heart or safety. If there is, tell me where it's at, because then I definitely don't want to support it. Because every business owner that I have talked to has said that we want to do it the right way. We just need to have some help here. We have to be able to survive, and that's why we're trying to work together with them.
Absolutely. Okay, we'll go back to Sam with a couple, the last few health department questions here that were sent in. Sam, the next person wrote, theoretically, what happens when you test everyone in the county, or at least a number that equals the population?
So IDPH uses a metric of positivity percentage based on those tested, not based on the size of a community. So when they do that, it doesn't matter the size of the population for whatever that area or that county is. We're looking at the actual individuals that we've tested. So that is why we encourage everyone to go out and get tested for two reasons. One, we've been shown that someone can test positive without having a single symptom, and we want to test those individuals, stop the spread. But then two, if we only tested those that were symptomatic and only tested those we thought were positive, our percentage of positivity would be off the charts. And per IDPH metric, that is what they are using.
So because IDPH is using a positivity rate, which we're seeing is being used throughout the United States,
Correct.
in many
That's
places.
not just
that is
Illinois.
the common
Correct.
thing that all states is that positivity rate. Because that is the metrics, you have to get a true sampling of the entire community.
Correct.
You have to get sick, not sick, and those that are asymptomatic but carrying.
Correct.
So in order to do that, testing is the way to go, and that's why we're encouraging testing.
Testing of everyone. So yes.
Okay. The next person wrote, what is going to be the guidelines for Halloween?
Oh, the golden question of the hour. So IDPH has put out some guidance for Halloween, and that is available on the EMA page as well as on the St. Clair County Health Department page. And communities are still allowed to participate in Halloween, and they are just going to have some recommended safeguards as they do with, everything that we've been opening, schools, when we go to the grocery store, it's going to be similar to the 3 W's. You're going to still wear your mask. You're still going to watch your distance. You're still going to, not wash your hands, have your hand sanitizer with you while you're out trick-or-treating. So it's going to be allowed. There's just going to be some safeguards in place.
Yeah, really the only thing I saw that they said absolutely no to was haunted houses.
Okay.
Just not a way to manage that.
Sure.
That offsets the risk versus the reward there.
Sure.
And I
Yeah.
think it's something that they need to check with their local communities to see if there's going to be any other type of special requirements that they're going to require. So.
Yes, sir. Sam, last one here for the health department today says, day after day, all I hear from the briefing is how much of a good job St. Clair County is doing than other counties in the region. But in reality, St. Clair County tests more and has more opportunities to test. Some counties have only had one mobile testing site since the beginning. St. Clair County is also encouraging people to get tested even if they're not sick. So is the county really doing any better, or is this giving people a false sense of security since there are large numbers of non-sick people tested?
So as we just discussed in 2 questions prior, the metric that IDPH uses is a metric of positivity percentage. So that is why we have to test a large range of people, as you said, those who are sick, those who are, not sick, those who have symptoms, those who don't have symptoms. We need to get a larger population because If we didn't, we would not meet the metric that IDPH is putting down for us to continue to move forward to reopen.
Okay.
And these are the metrics, as you said, IDPH has put down as the guidelines through the scientists and the medical experts
Exactly.
that have chosen to use this. And as Brian said, it's just not in St. Clair County. That's the metrics that's being used around the country.
Correct,
basically.
yeah, not even just the state of Illinois, throughout
Yes.
the country.
Okay, thank you very much. Director Simmons, a couple more that came in here. One says, are there any restrictions on huge subdivision garage sales or flea markets? Over half the people don't mask up. Someone asked me about it, and I thought it could be a big spreader.
Well, and it probably could be, but yes, there are still the requirements of the 25 or less. We had calls of the big flea market that was taking place in Belleville, I think, last weekend, and they went in and found out that needed to be corrections made there. And so they have canceled, my understanding is the other events for the rest of the year there because they weren't able to follow the mitigations that were set in place. So, but yeah, I would say, and it's your choice. We get calls all the time about a certain store that doesn't have their mask on. It's your choice to go in there. We want you to support your local businesses, but you as an adult have to be accountable and responsible. If you don't feel safe and you know that they should be wearing a mask, then don't get in no big discussion, big argument with them. Just go someplace else.
Okay. The next person says, when will the Facebook page act professionally?
Well, I don't know what they're talking about. We're going to act the way we've been acting for 205 days on here. People ask questions, they leave comments, they expect transparency. If you don't like what we're giving you transparency, if you don't like the truth, then there's nothing that says you have to follow this page. We truly appreciate all the followers of Team St. Clair, those that come on here every day, the new ones that come on. But if you're looking for somebody to sugarcoat it, we're going to give you the most up-to-date, accurate information that we receive from the health departments. We don't dream these numbers up. We receive them. As we said, Sam and the staff, Barb, the director, everybody over there are working day and night to bring you the most accurate information. And that's what we said 205 days ago. We needed to have a source to keep our citizens updated, and that's exactly what we're doing. We're also entitled to our opinion. And our opinion is that this virus is real. It is, like I said, it has taken away 196 of our county residents and over 8,000 across the state of Illinois, and I think a couple of million, if you add everything up around the world, or what, I don't remember.
A couple 100,000 here just in the United States.
In the United States. So we're going to continue to do our job as far as professionalism. That's the operative word. We're going to respond the way people are responding to us. We put up information, we put up graphs, try to meet everything that everybody asks us to do. The only thing we won't do, for the few of you that want to come out there, make this a political agenda, a religious agenda, we're not going to do that. We have said that from day one. This virus does not know your political agenda, it doesn't know your religious beliefs, doesn't know where you live until it knocks on your door. And if that's hard to understand, and if that's being unprofessional, then so be it.
All right. The last person here says, maybe it's time for more doctors to come and update the status of the virus.
We have been talking with our local hospitals, who's been a partner in this for 205 days. Keep in mind, they're busy. They have patients they're taking care of. They have other obligations. But we talk with the CEOs of the hospitals and some of the doctors, and so we may do that. But once we do, we'll make sure that it's posted and you can tune in. And I'm anxious to hear from the physicians all the time, because I'm still waiting for the one to come on here and say it's over with.
Absolutely.
That's what I'm waiting for.
We've been joined for the last several months each Sunday with Susan Sarfati from the St. Clair County Regional Office of Education as the superintendent there. This past Sunday, Chairman Kern wished her a fond farewell as she announced her retirement and moving on to greener pastures to take some time for herself. We're happy to be joined this Sunday by the new St. Clair County Regional Superintendent of Schools, Dr. Mark Eichenlaub. who's here with us. As we do each Sunday, we usually get a question or two in about schools, and that is no different this Sunday. So, Dr. Eichenlaub, we're glad to have you here with us. Thanks for joining us, and hopefully we can continue this great working relationship with the superintendent of schools, because schools are definitely front on everybody's mind as a lot of our school districts are starting to open back up.
They sure are, and thank you for that warm welcome.
Well, we appreciate it. You got some big shoes to fill.
Oh, absolutely. Absolutely. Susan was wonderful.
Yes. You got a question for him?
We do. We did have a question coming for schools this week. It's something we've talked about before, but we'll revisit it here. It says, has there been any outbreaks at schools that are doing hybrid learning plans?
So we don't track by school district, and we don't have those numbers. Those are kept individually, so there's nothing I can report to that.
Okay. So yeah, as we've talked in the past, it remains up to the individual school district whether or not they make those announcements. IDPH currently has a requirement that congregate care facilities have to be publicly announced, but there's not something for school districts or businesses at this time.
That's correct, so it remains at the local level.
Well, that's good, and we know the schools work real close with IDPH and with our local health departments on any of that would take place. But we really appreciate you in your new position, and we wish you well, and welcome to Team St. Clair.
It's great to be part of Team St. Clair.
Fine, thank you. And thank you for joining us this Sunday for our lengthy question and answer. We hope we were able to answer your questions. There was some that we couldn't get to, but we'll try to get an answer and we'll post them. We appreciate everybody taking the time on this Sunday afternoon to join in Team St. Clair. Keep pushing forward. We'll keep you informed on any results we get on our battle to try to get us back to phase 4 or some form of that. Hopefully this week will bring us an answer one way or the other. But until then, everybody stay safe out there. We'll be back with Cindy and Daisy in just a few moments to translate this into our Spanish communities. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, jocks, bears, cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock